Thank you, President. I want to thank everyone first and foremost for making a contribution today. And I just want to bring it back to the issue here, because what the motion actually is seeking to do is to investigate this bill, have a bill review before the Legal and Social Issues Committee. So it's about parliamentary process. It's about the levers that we have available to us to look at the validity of this bill and see if it is fit for purpose, see if there is more information needed. And I appreciate that many of you have raised concern around health and well-being, around mental health, around the impacts of vulnerable communities, around resourcing of police and the impacts on the judicial system, the prison system, and the costs associated. And this is why we are seeking to have a look at this bill and see if it is fit for purpose. Now, those that have been I guess, against the principle of moving forward with cannabis reform, I mean, my question to you is, what do you want to do? Do you want the status quo to remain? Because it's not working. It is nearly 100 years of failed public policy, 100 years of failed legislation. Now, if this was any other form of legislation, it would have been scrapped by now. So to continue to perpetuate arguments that are outdated, unfounded and frankly stigmatising is really quite inappropriate. Just to take you up on some of your points, Ms Crozier, to say that we're sending the wrong message to the public, I would argue that you are sending the wrong message to the public, and your concerns raised about the most vulnerable in our community and the impacts of, well, what has the criminalisation of cannabis done and who has it impacted the most? Our vulnerable communities. Now, with the AMA, interestingly, I work quite closely with the AMA and we've done a lot of work around medicinal cannabis, access to cannabis, medicinal cannabis in the hospital system, and we're working quite closely on making sure that medicinal cannabis patients have access to their medication and vaporisers to ensure that their health care approach is led, particularly in the hospital system. But in regards to the AMA, I would argue, I mean, how many lives have been destroyed by the over-prescribing of benzodiazepines? And is this something that the AMA is taking up, and is this something that is at the forefront of their questioning? I'd also like to talk about Mrs Herman's contribution, and in particular you raised the issue around the South East. Now, as the member for the South East, as well as my colleague Mr Limbrick, we know very well how much cannabis is something that people of the South East really do care about. The latest Pennington data shows that in the local council areas of Casey, Greater Dandenong and Knox, 10,977 people were arrested for minor cannabis charges between 2018 and 2023. Now, are you saying that you don't care about those people? Is that what you're saying? Because to indicate that you think that this will cause major issue in the South East is just untrue. And we also have to remember that I got elected under the legalised cannabis banner in the South East on this particular issue. 5.15%. Now, that was my first preference primary vote, but it was the highest vote out of any of the regions for cannabis. So I do argue with you that in the South East, it is a really important issue for the people of the South East. I won't continue because I'm just going to get more fired up, but I do thank everyone for their contributions today, and I commend the motion to the House. Thank you.